Okay, it is noon, so we'll go ahead and get started. I'm recording this, so we'll have it for later on. My name is Tamara Ogle. I am a Purdue Extension Community Development Regional Educator, and I'm sure you're joining us because you've joined some of our other webinars, usually on property taxes. So we're branching out a little bit to help you gain some extra resources in this time, right, or this situation that we're in. So I'm really excited about the webinar that we have today. We have with us Dr. Hwanseok Song. And Dr. Song is an assistant professor in the Brian Lamb School of Communication at Purdue. And he earned his PhD in communication from Cornell University, his MA from Johns Hopkins, and his BA from Yonsei University. So Dr. Song and I met when he agreed so graciously to do this webinar for us and had some great conversations. So I'm really excited to be able to share his expertise with you. So Dr. Song, I'll pass it off to you.
Thank you. Thank you. Thank you very much, Tamara, and the Purdue University Extension Community Development Unit for inviting me here. And today I'd like to share with you some ideas about how to do crisis communication at the local level to meet the unique challenges of this pandemic. And in so doing, I'm not going to reinvent the entire wheel. Instead, I'll be using the official CDC guidelines for crisis communication that have been in place for a long time and do my best to show and interpret for you what those principles in the guidelines would mean for communicators at the local level. In this unique pandemic situation. Okay, so my name is Hwanseok Song. I'm an assistant professor of communication, and I'm working at the Brian Lamb School, where I do research, and also teach subjects on risk communication and science communication. And in particular, I'm interested in how people come to trust or distrust authorities in context relating to risk. So those are some of my research interests. And in this talk, I'm going to assume that everyone here in this webinar are here because you already realize how serious this coronavirus pandemic is. And so according to the updates released last night by the Indiana state government, we have in this state 3,039 positive cases. And also, we lost 78 people to this. And if you haven't been following the trend, it's really catching up speed. So yeah, there's a very good reason that we should be concerned about things. And you can see that people who are living in the suburbs and in the urban areas are showing higher rates of positive cases. In a crisis situation like this, and just like healthcare, effective communication also becomes very essential. And when leaders, for example, make important decisions restricting people's movement, we need to quickly and accurately disseminate that information so that it becomes effective. People need to know in the first place in order to act. When our healthcare providers also are running out of essential equipment that protects them, you can use communication to mobilize support and ask for donations. And in more extreme cases, communication is literally and immediately about saving lives, connecting healthcare providers and suffering patients before it is too late. The CDC has a 400-page manual on crisis and emergency risk communication. It is a comprehensive manual that covers topics including psychology of crises, crafting messages, analyzing your audiences, and how to engage with them, how to develop crisis plans, how to designate your spokespeople, how to work with the media, and how to use social media. And if you are really planning to sit down, gather your team, and develop a full comprehensive crisis communication plan, probably this should be your number one reference. Unfortunately, for a lot of people who cannot go through an entire 400-page manual, CDC also released this one-pager covering how to communicate during crises-related situations related to infectious disease outbreaks. It's based on those 6 principles that also happen to be the pillars of the larger CDC manual. So today I'm going to use this and try to break it down for you so that these principles become relevant for those of us working in local communities. So these are the 6 principles, very simple, right? The first, be first. Number 2, be right. Number 3, be credible. 4, promote action. 4, express empathy. 5, promote action. And 6, show respect. So let's take a look at each of these principles. Number 1, be first. Once people recognize incorrect information as some truth, it is very hard to correct that afterwards. For this reason, under crisis situations, we need to stretch ourselves a bit to be the first one to provide people with accurate information as soon as possible amongst the public. All actions to fight the coronavirus should be based on shared understanding of the situation. If people don't understand what the situation is and don't share that information with you, then when you're trying to take more aggressive and drastic measures to address the situation, people don't know what's going on, why you're doing this, and it's very unlikely they are going to willingly cooperate with you. So it's always important to have a shared understanding of the situation with your people. And first of all, to ensure that everyone is on the same page, share information with your community. You should share the basic community level facts and do that on a predictable, regular basis, such as on a daily basis. Sometimes in a rapidly developing crisis, you might still be collecting facts before people are wanting them. And in those kind of situations, it's okay. It's completely okay to share only the facts that are available to you, while also acknowledging that there are currently ongoing investigations to collect further information. And what this does is it prevents speculations and rumors from developing and circulating, and allows community members to understand why you're doing these things, why you're taking these aggressive measures to mitigate the situation. When rumors have already developed, then you should try to adjust them. You shouldn't sit on them. You should try to adjust them as quickly as possible. Fact check them if you need to, and give people the right information, correcting what's wrong as soon as possible, so that you can prevent the further spread of false information. This is part of a website from Tompkins County, New York. I used to live here once, and they update community level facts on a daily basis. And you can see nothing here is fancy in any sort of way. If you want fancy, you can go to, for example, Nevada state government's website, and they have these like great dashboards. But no, don't waste your time doing something like that. Something as simple as this will work at least at the community level, okay? So the point here is to update this regularly so that visitors can understand the pattern of information coming out from you and believe they can come back to update their own understandings as the situation develops. So yeah, very simple table here where you have the total number of tested individuals, positives and negatives, the number of casualties, and the number of people hospitalized. So it gives people a basic understanding of the situation. So have something simple like this and consistently update it so that people can know what's going on. Another strong benefit of this is that it makes it easier for local news media to pick this up and transfer it into their own material. So this is the Twitter account of a local news media called the Ithaca Voice, serving the same region. And you can really see they literally lifted this table from the Tompkins County website. So now this table is having a further reach, like it's reaching more people out there. So it becomes more valuable now that other people are picking up on this table and further broadcasting it on your behalf. So if you're working with local media, especially those running social media accounts, this is a very good practice. You might want to think about cooperating with them. So yeah, consistently updating this information on a daily basis, even for this local news media. The second principle is be right. So you lose credibility every time you say something wrong. So really, you want to be careful about this and be sure to thoroughly fact check your messages with someone with relevant expertise. Again, once people adopt wrong behaviors, then it becomes far more difficult to correct that later. Make sure different people from your organization are not saying different things. You should keep consistency. And it is for this reason, many organizations in a crisis mode designate a single spokesperson and prohibit everyone else from being in touch with the press. Maybe this is a different kind of a crisis where the risk is coming from outside, so you're not really to blame. Unlike those kind of crisis situations in private companies that are coming from inside. But yeah, I think it's still a good idea to have a spokesperson who can be a reliable source and a contact point for your local news media. And also check if your messages stay consistent with the official guidances coming from state or federal level governments. Okay, you don't want to be inconsistent with that either. And again, for the sake of transparency, include what you know, what you don't know, and what you're trying to do to learn about what you don't know, and put that all together if you want to acknowledge some uncertainty in your messages in a very honest way. So for example, think about something like this. So the CDC has been advising the American public not to wear face masks since the beginning of this outbreak. And the Surgeon General has made that message even more explicit, denying the effectiveness of face masks. I came from South Korea, where the officials are actually strongly recommending the use of face masks. So if you're crossing borders like me, maybe you could be really confused about what is the right guidance on this. And recent reports suggest that the CDC might change that advice, telling people that you should wear face masks now, in fact. And this will be a major blow to their credibility, I think, given that they have been issuing this recommendation with such confidence and a determined tone. It'll be a major source of confusion and diminish the effectiveness of future advisory coming out from the agency. This is not the kind of advisory maybe you will issue from the local level, but think about something more basic and simple, like, for example, where to go to get tested. For example, if you set up a new drive-through test site and release some instructions about how to go, where to go, and people arrive there only to find out that the test site is not ready yet, then people are going to start questioning the reliability of information that they receive from you. So you really don't want to find yourself at that kind of position. So be sure to make your message correct and accurate. And this leads us to the third point, which is to be credible. Okay, again, credibility is a limited resource. And it is research shows that it is much easier to destroy credibility than to build credibility. Research also suggests that there are largely two dimensions to credibility: warmth and competence. So you have to demonstrate both, that you care about what's going on and also that you are on top of things. But whatever bad things happen during this situation, always remember, stay honest and be transparent. And you should never lie. Okay, do not lie. A lie begets a lie, which begets another lie. And any minimally functioning a group of public or the press will eventually find out that you did lie. And this will cause even larger and greater damage to your credibility. So always, always tell the truth, even if it means bad news for you or your boss in the short term. Think about the long term and your credibility as your asset. Show and signal that you care and you're intending to do the right thing, even if not everything will always go your way, but you can always show that you're still trying to do the right thing and make that appear. Do not make empty assurances that you are not certain about, and acknowledge the situation as it is. Also, to demonstrate competence, use scientific evidence. If needed, use input from experts. And I strongly recommend you to put all kinds of politics aside. So people's lives are at stake here, and this should never be about you or your boss scoring political points, and it should always be about saving people, and that should appear in your attitude and in your messages. There are all sorts of media channels that you can use, and you can use to establish your presence. Especially at the local level, local newspapers and radio can be really important. But for today, I'm going to really talk about and focus about websites, because it is something that first all of you have, I assume. And also in this unique case, we lost our main physical offices, most of us did. And this is going to be your temporary virtual office. So if your website does not look any different from what it looks like in ordinary times, then probably you should reconsider what you're doing. In these times, you establish your credibility through your website because it comprehensively provides people with all the vital information they need. And also it signals that you are taking this situation seriously with care. And it also builds confidence among people that they can come back to you for answers whenever they have questions. So it's really important to have a good website presence that takes the situation seriously. This is where I live, the city of West Lafayette, and this is the first website I looked into. And here, as you see, it doesn't look very different from what it looks like in ordinary times. So no sense of urgency, which makes me think, are they even dealing with the same kind of crisis that I am dealing with? Okay. If you're doing anything related to the situation, a link or a hyperlink to those contents should be visible and salient and accessible at the very top or in the middle of this front page that people first land on. If I scroll down from here, if I scroll down, then this is what I see. Still, I see this generic welcome message from my city, and only in this corner, I see a few news and notices, maybe this public health alert menu. So very little that signals that there's something going on in our situation, and even fewer about what are the community resources specific to West Lafayette. Then I started to go around some other websites, and please forgive me if you are already doing an excellent job and I failed to recognize yours because I only was able to visit only a few number of websites, but I thought South Bend was doing a pretty good job. So if you go to their website, there's this huge salient banner here that is very saliently presented, and it is about the coronavirus. So you can click here to go to their entire body of coronavirus resources. So I think they're doing a pretty good job. And if you actually click on that link, you'll find links to authoritative sources of information related to coronavirus information, such as the Indiana State Department of Health, and also the CDC. And you can also find purpose-specific links here that are related to their community, right? So how are they supporting education? What about childcare? What about community health? What should people do when they are looking for donations or trying to donate things and volunteer? So all these kind of great information. So they're doing a pretty good job. What really struck me as a very pleasant surprise was Delaware County. So it's a county that has about 115,000 in population. So not so huge, but they're doing such an excellent job that I really wanted to recognize what they're doing here. And yeah, if you land on their first front page, you can find two very salient hyperlinks that are made very vigilant on their first page. And these are the hyperlinks that lead to what they're calling their coronavirus information hub. Okay, so I click on this link, and this is where that leads me to. So they have a dedicated coronavirus hub. So over here, contact information about whom to call when they have questions about the stay-at-home order. And here again, categorized informations related to different purposes. So it's really interesting. So I clicked on this, which is about neighborhood level resources and information. And you see an entire collage of all these essential information related to the community and the neighborhood level. Okay, so if you know about a resource that is not listed, then this is where you can submit that. School meal assistance for students who might be starving out there because they're no longer going to school. food services, what United Way is doing, and even mental health support resources all the way down here. So I thought they were doing an excellent job. But then I was starting to wonder, but where's their basic update about their county level facts? Where's that information? So I go back to the front page. So it's here, right? So they're doing daily press releases, updating their statistics about their county level coronavirus stats, the number of cases, how many people are in hospital, etc. But then this also started to catch my attention. Okay, so they have a guide to face mask selection and use, and it made me wonder, this seems inconsistent with the CDC guidelines. Okay, so I'm personally a fan or a supporter of everyone wearing face masks, but here it's a different story when a official governmental source is promoting face masks, which seems contradictory with what other levels of the government are recommending. So I click on this, and they have this document, which seems to be coming from a private company about how to select masks. So I'm not expert enough to tell whether this information is any valid or not, but what I can tell is that when you have a discrepancy with the official CDC guideline, this will probably negative effect into Delaware County's credibility in this kind of situation. So this was a caveat to their otherwise excellent web presence related to the coronavirus situation. Number 4, express empathy. So under a crisis situation, especially in one that is that is very temporarily extensive, like this one, people will start to develop and suffer from a lot of negative emotions, including anxiety and fear and distress. And this can be coming from patients and also people coming from under extended stay-at-home orders or quarantine. And as the disease spreads, more constituents will be experiencing losses. So according to research, people are very good at empathizing with 1 or 2 victims that are identified, but people are very bad at emotionally processing high numbers of death. When a lot of people are dying, even in such massacres, these numbers start to just feel like statistics, and people are not really able to emotionally connect with those numbers. So communicators should always consciously remind themselves that these numbers are real, and behind every single number and every single increasing number out there, there is another positive patient out there. There's another person dying out there, and for every person dying, there are probably at least 10 times more people deeply mourning about their losses. So when you are communicating, your attitude should appropriately reflect the gravity of this situation. Also, in these times, people are desperate for hope, but I encourage you to stay away from delivering empty reassurances. You should acknowledge people's emotions and the situation as is. Highlight the positive facts if you can, and if they are confirmed, and also focus your message on what you're doing to improve the situation, but stay away from giving empty reassurances because you just feel like you need to give something to people when they seem to be asking for them. These were the expressions of our Congress leaders when the $2 trillion stimulus or relief package was signed and released. And as much as they think this was a major achievement for them, I really want to remind them that you shouldn't be smiling when people are dying at rapid rates. Also, CDC was doing this, a photo shoot contest in their official Twitter account just a few days ago. And I know you're trying to bring some positive emotions to people who are tired about their stay at home or self-quarantines, but people will figure that out on their own, or people can always go to mental health support resources that can do a better job at this. These kind of photo contests, I believe, when they're promoted by the government, will only make these governmental sources look callous when they have to deliver very important information to the public. Number 5, promote action. And this is an unprecedented event, and people are looking for guidance. People don't know what's going to happen, and they want to learn what they should do. Please be there for people and tell them what to do according to their situations. Of course, we all thoroughly learned how to wash our hands or physically distance ourselves from others, but it doesn't hurt to repeat that just to make sure that everyone gets this information. People also need to know what to do when they feel symptoms, okay? We don't want people to realize that they have a fever now and suddenly start to walk into urgent care or emergency rooms. If we do massive large-scale testing, for example, and by massive large-scale testing, maybe we could, in the future, we might be doing something like, we might be finding people who are not having symptoms and proactively contacting them and telling them that you should come and get a test, okay? And maybe we can have them through the large drive-through testing sites. In that case, if something like that happens, then we need to inform those people. If people can help others, and especially those vulnerable people, such as seniors, who might be afraid of going out to do very simple things, such as essential things, such as taking groceries, then we need to tell them how to do that, so that they can get these volunteers can connect themselves with these people who are in desperate need. When you are promoting action, please keep your messages simple, short, and easy to remember. And this is a great graphic that I gleaned from the from Google's coronavirus information page. And look at the simple image, right? So do the 5, and all these 5 very essential actions promoted with only 4 words, with 1 keyword for each of those 5 behavior. So very simple graphic, and probably a very easy way, a simple way to promote these 5 actions. Also, this was from Stearns County, Minnesota, and this is from the Twitter account, and they're trying to mobilize help for to get more personal protective equipment for their healthcare providers. And look at the simple message. So a simple call for help, and then telling people what they need, what is in need, and then what to do. Call this hotline to donate, right? So very simple message. And then for those people who want to learn the full details about how to do this, they're redirecting them to the website where you should always keep your comprehensive set of information and with full details available. So yeah, these are very good examples of how you can do very simple and short and easy messaging. And finally, show respect. So first of all, because communicators always need to connect people in need, to those who can help, we should be actively listening, right? So stay attentive to your community members, and also stay in touch with your local leaders, and have a consistently maintained channel to learn about what are the things going on at the neighborhood level. Also, be respectful, and research shows that maintaining a respectful attitude can go a very long way. It makes it easier for people to accept unpleasant decisions and results. So always, please stay respectful to people. Do not dismiss their fears or call people unrealistic, unscientific, or irrational. There's probably something that is underlying their fears when they express that, okay? Try to carefully listen to them and try to understand where they're coming from, what they're really concerned about. Try to understand the values that are behind their expressions of concerns and fears. So now that many of our physical offices are closed, you may need to move to virtual meetings to keep listening to people and keep your governmental functions running. And this is from Aurora, Illinois, and they have made their city council meetings available public online. And if you're doing something like that, also please make this visible so that community members can have their voice heard during these times, especially because they may have a lot to weigh in and demand, right? So this is now your new office hours. This is now your new official meeting. So you may need to adapt and adjust to this reality, especially given that we may be in this for longer than we wanted and expected. So those were the 6 principles. And to really simplify things, communication in ordinary times look like this. I'm really simplifying things here. And yeah, you are exchanging information with the public as an authority, right? So there is information that you give the public. There are also inputs coming from the public, and the public is demanding you for more information. But a crisis communication I think it's not conceptually much different from that basic template of communication, right? All that is happening right now is that you are in a situation where you have to bring this in a tighter loop, right? So you have to make this more quick, more accurate, and you have to be more attentive to things as they develop, because every day is a different day in a crisis situation like this. So try to identify urgent needs and share your understanding. Give guidance about what people need to do. And eventually this kind of communication work will contribute to save human lives. There are currently existing tasks for communication, right? So I already covered some of these, so I'm not going to go through all of these. But in addition to these existing tasks for communication, also try to proactively prepare for upcoming tasks, okay? So if there is, for example, a large cluster in your community where you have a lot of positively testing people, and maybe you want all the visitors who are at the site to come in and get tested. You want to find them and test them. And in that case, you might need to alert those people, but how are you going to reach them? You need to think about that. What about when hospitals are getting overwhelmed, when beyond their capacity, as a lot of people are worrying these days? What are the needs then, and what do you need to communicate to people in that kind of situations, right? Do you want to, and you need to be, in this case, you also want to be in consistent communication with your healthcare facilities in your area, because they might actually suggest that in case we're overwhelmed, maybe you need to redirect patients here or here. Okay, and finally, when all of this becomes over, then you might want to communicate about your local economy policies and measures so that you can quickly come back onto a recovery phase and revitalizing your local economy. When people think about crisis communication, this is where a lot of people start, and they start thinking about these blanket approaches and blanket approach level considerations. So who should be our spokesperson, or how do we frame messages? How do we manage our social media accounts? But instead, I recommend you to take a customized task-centered approach. So think about the nature of your task first, what that task demands, and what can you do in face of those demands, given your resources. So think about your task and develop a customized research that is appropriate for each kind of different task. So different tasks are different in urgencies, and also different in who specifically in your community those kind of relevant messages need to be reached. So every task has a different nature, and depending on the nature of your task, you may need to customize what channel am I going to use, and also you may need to customize what content am I going to use. So for example, if there is a stronger lockdown being imposed, then you may need to communicate that, of course, with your press releases and your website, but also you may need to consider something more aggressive and something more intrusive, such as using the IPAWS system. So in case you're not familiar what the IPAWS system does, it is short for the Integrated Public Alert and Warning System. And for those people who have training to become alerting authorities, they can, at all of these levels that go all the way down to the local level and tribal levels, these people can even give input to the IPAWS system, saying that we need to alert people in this specific area and give them with this kind of alert. And depending on how you set it, it can go through all the televisions, radios, and satellites. It can give push notifications to people. And if you have ever received Amber Alerts, this system is where that information is coming from. And probably you should use the same system if you have a tornado approaching in your area, or there might be situations in this kind of circumstances where you need access to this kind of system and immediately and urgently alert people about this. Especially consider that people are no longer meeting each other. So you really need to reach people individually. You cannot expect information going across from person to person. So think about this, the nature of this situation, and how you can reach everyone as individuals, assuming that they are fragmented and separated from each other. These are the alerting authorities, approved alerting authorities in Indiana. So yeah, if your county or your local level agency is not here, but maybe if you might want to consider training and get access to this IPAWS system in the future. And if you finally gain access to this system, this is the kind of message you can send people. And I believe that there's no way for people to turn off these emergency alerts. So it's a very reliable method to make sure that everyone is receiving the message you're trying to deliver. So to repeat, 6 principles of crisis communication: be first, be right, be credible, express empathy, promote action, show respect. So please remind yourself of these principles as you develop your crisis communication plan. And thank you very much.
Thank you so much, Dr. Song. I want to open things up for questions. So if you have a question, feel free to type into the chat box.
Yeah, I just want to tell everyone that I'm also hard of hearing. So yeah, it's just much more easier for me to read things in text than having things communicated over audio. Thank you.
I'll give people a minute or two to type in case they do have a question. And it looks like we've got one popping through. Can you read that? Oh.
Yeah, so the question is, for task-centered communication, how do you find an accurate source of information? So the first places you start is apparently with governmental sources, right? So official health authorities such as the CDC or Indiana state government's Department of Health, but also, if there are things related specific to your community, then yeah, you should talk with the experts there. And yeah, you really want to find people who can talk with some authority, and yeah, not just you never really want to develop your messages based on things that are from questionable sources, unapproved on the internet. Yeah, I'm not sure if this sufficiently addresses this question. So please, yeah, if you want to follow up on that, let me know. Number 2, how does a government entity find out about becoming an IPAWS authorized? Okay, so let me Google this for you. And IPAWS. If you could just Google IPAWS, there's an entire website about integrated this system, and all of the information that you need should be here. And yeah, so there is a page about alerting authorities, and probably there should be, I'm not sure I looked into this entirely, but probably there should be instructions about how you can become an authority, or yeah, at least a contact point. So there's a contact us section here that you can use to ask for more information about becoming an alerting authority.
Well, and I don't know if you can go back to that list of alerting authorities in Indiana.
Oh, yeah, sure.
I know we just went through that process in Carroll County not too long ago. And so maybe reaching out to an EMA director on that list would be another way to get some information about how they did it locally.
Yeah, so these are the current also alerting authorities in Indiana, and I also see that a lot of other universities are also listed as alerting authorities. So yeah, it can be police departments, it can be fire departments, it can be emergency management agencies, it can be the county, and it can be, it turns out it can be even in universities. So if you really have an urgent need to use this system, I strongly encourage you to find out more about that.
One of the questions next was, will this be available later? And we did record it, and it will be uploaded to our website later today.
Oh yeah, sure. I will upload. Are you going to upload the recorded webinar to the website?
Yes, yeah, and if you want to provide slides or any resources,
sure.
we can upload that too.
And I'm going to give you the slides, and we should be able to upload that together. So the next question is, what advice do you have for local units of government to respond to or ignore misinformation propagated on social media? So I think it's not necessarily the local level local level community's job to address all the misinformation flowing around in social media. And yeah, probably if you try to, counter argue against all of those and fact check against all of the enormous amounts of misinformation from your channels, probably it'll end up being a noise that will drown out the real signal, the real information that you're trying to give to your constituents. And you might even end up in unnecessary arguments and waste your energy. What I do recommend, though, is address these rumors and false informations when they concern specifically your local level communities. When it has to do with specifically about your local level communities, please address them and correct them as soon as possible. And the best thing to do probably is to give people the correct information before any sort of false information or rumors start to develop. Try to be as proactive as possible, but yeah, if anything develops before you can address them, then at the local level, if it's at the local level, please try to address them as quickly as possible.
Dr. Song, if it's on social media, would you address comments or would you create a new post with that corrected information?
I'm sorry, could you say that again?
If it's on social media, the rumors, would you address comments or would you create a new post to address that or correct that information?
Oh, so are you talking about this webinar, or are you talking about the crisis situation?
I'm sorry. So that question, I know we've had come up in individual communities where people will comment with rumors in a social media post. Do you correct that in the comments, or do you create a new post when that happens?
Yeah, if it's directly mentioning you on a social media, then yeah, if you're confident that you can fact check that with a authoritative official source, yeah, do that, because now you see that it can be a source of incorrect rumors that can spread amongst your community level people. And yeah, I have this very interesting case in South Korea when they were trying to really fight this spread of the pandemic. And there was a small rumor that spread across a small group of people who believed that you can spray people with salt water, and that'll somehow keep people from getting infected with coronavirus. And a church was trying to do that by spraying into people's mouth, and actually that became the very source of information. So this can be very damaging. So it can be a more generic rumor, but more spreading focusedly in your community. And if you see that, you need to correct that as well. right? So you don't want to have those kind of facility-specific or community-specific clusters developing in your area. So always try to be attentive to those false rumors, especially if they are about, false information about, getting people immune or cured. And you don't want that happening in your community. I also see the question, have you heard of this in this Together campaign? I don't know. I haven't heard of it. But yeah, I'll take a moment to learn about what it is after this webinar. Thank you.
Well, I don't see any more questions coming through, so I just want to take the opportunity to thank Dr. Song again. This is definitely not Dr. DeBoer in my area of expertise, and so we were really grateful that we could bring in Dr. Song to give some really salient advice, and I appreciate how you really looked at some evidence or some examples from Indiana and from the United States, from around the United States, of what to do and what not to do. I think that that was really fantastic. If you have any questions for Dr. Song, feel free to reach out to him. His contact information is listed right now on the webinar. And as I said, we are recording this, so I'll get this posted hopefully to the website by this evening if the internet cooperates. And I'll also post his slides there as well. So thank you, everyone.
Thank you very much. Thank you.